All right, chapter 13, medications and drugs. Safe medication use. Okay, so we're going to talk about a couple of what we call over-the-counter drugs, and we're going to talk about a couple of prescription drugs here. All right, what steps do you need to follow to use medication safely? Follow the directions. Right, exactly. Follow the directions. All right? After studying this lesson, you will be able to identify the main reasons people use medications, differentiate between over-the-counter and prescription medications, describe different ways to take medications, summarize common health risks associated with taking medications, list safe strategies for choosing and using medications, and explain how to store and dispose of medications safely. For what reasons would a person need to take medications? Of course, because they are sick at some point. Okay? What are some of the health risks of taking medications? What are some strategies for using medication safely and effectively? All right, medication. Substances used to treat disease or relieve symptoms. Relieve symptoms. Okay? Substances used to treat disease or relieve symptoms. Okay? You can get medications that are prescribed, and they will be used to treat a disease or something you may have. Most of the time, the over-the-counter medications are just to relieve the symptoms. When you buy stuff out of Walmart, when you buy stuff out of Target, those are called over-the-counter medications. Those are just used to relieve the symptoms. It's not curing it. You're not curing a cold. You might have got some relief from it. It may have something in it to relieve you of the symptoms that you're having, a runny nose or a headache or what have you. But it's just aiding in that. It is not, is what? Oh, okay. All right. Food and Drug Administration. Okay. Government agency responsible for making sure medications are safe, effective, and secure from tampering. Decides whether a medication requires a doctor's prescription. Okay? The FDA. Okay? There's some things that we take that are not FDA approved, or they don't need FDA approval. When you go get things out of the GNC store, those things are not FDA approved, or they don't need approval. Okay? Those tampering, secure locks that they have, child locks on medications, those are regulated by the FDA. Food and Drug Administration. Okay? Moving on. Take a picture, whatever you need to do. Over-the-counter medications. Sold without a doctor's prescription. That is what you need to know. OTCs are sold without a doctor's prescription. You can buy it in Walmart, Target, Jenny's, whatever that little food store is. Any of your corner stores, those type of things. You're just buying it over the counter. Okay? Important to follow labeled instructions and warnings. Most common are analgesics, okay, or pain relievers. Give me an example of a pain reliever. What? Advil. Give me another one. Tylenol. Okay, so Advil and Tylenol, that is the brand name, is what we call it. Okay? The generic name would be for those, would be Advil would be ibuprofen. That is the generic name. That is the name that cannot be occupied by one maker. Okay? Ibuprofen is the brand name. Advil is the, but when you go by Equate and those Walmart brands, it's the same drug, guys. It's just in a different package. It's the same drug. Comes out the same factory almost. Just got a different divot on there. Advil's got something on the little thing, and the Walmart brand's got a different one. Same thing. 200 milligrams of ibuprofen is 200 milligrams. I don't care if I packaged it, Advil packaged it, or somebody else packaged it. It's the same 200 milligrams. Okay? So don't waste your money buying into the advertising that you see on TV. Oh, this Advil, it works so much better. No, it doesn't. It's the same. It's the same. Okay? So you have ibuprofen, and then you have Tylenol, which is an acetaminophen. It's a pain reliever. It's just a different one. It has different reactions. So usually we give kids Tylenol because it's less aggressive. Okay? Works a little slower, but less aggressive. Okay? All right? So know the difference. Thinking critically, OTC medications. What are some commonly used OTC medications with which you're familiar? I just gave you those. Okay? Tylenol, ibuprofen, what is it? Vapor rub. Yeah, my grandmother used to use that a lot on my chest, under my nose, get things kind of clear, you know. Do you use these medications? Yeah, some of y'all is taking some aspirin or Tylenol or Bayer or something at some point. Okay. Prescription medications can only be purchased with a prescription from a doctor or other licensed healthcare professional. Different types have 4 different functions. Okay? Antibiotics, antivirals, anesthetics, and antidepressants or antipsychotropics. Okay? All of these are prescribed for some reason or another. Okay? Just know that prescription medications are only by a doctor. I don't know that they would ask you any of that on the bottom. Okay? Antibiotics, there's a bunch of them. There's a bunch of antibiotic uses. There's antibiotics you use to prevent infections. So say if you got a cut on your arm, there's a different antibiotic than if you had a really bad sinus infection and it had to clear, and you're trying to clear it up. That's a different type of antibiotic. It's still antibiotic, it's just different. Okay? An example, Keflex would be an antibiotic that you would use if you got cut or something and you wanted to prevent something from being infected on your body. That would be something we use. Okay? Doxycycline or monocycline would be something we use if we were trying to clear up a sinus infection or something like that. Okay? All right? Health risk of taking medications, side effects, interactions with other medications, foods, drinks, drug sensitive or drug allergies. Okay? You should not take antibiotics with alcohol. It kills it. If you're sick and they gave you an antibiotic, don't drink. You're killing it. Okay? You're killing the effectiveness of it. Okay? Tolerance, dependence, substance use disorders with long-term use. Okay? That will be more. Drugs are on a schedule. Okay? And the schedules are different. When we talk about marijuana and cocaine, that's on one schedule. If you talk about ibuprofen, that's on another schedule. Okay? So before you graduate and you go out there and you think you want to go into a life of crime, know that if you do a certain schedule for a drug or you get caught with a prescription pad, you are going to jail, period. Just know. Okay? Some drugs say take them with food. Most of the time, your over-the-counter drugs don't ask you to take it with food. Most of the time, those are just prescriptions. Okay? Medications are powerful substances that alter the body's chemistry functions Because of this, it is important to use medications as intended. This includes following the medication instructions, using medications responsibly. Okay? This is going to be an over-the-counter label. Okay? I don't even know what this one is. But it'll make you drowsy. One side effects make you drowsy. Avoid alcoholic drinks when you're using it. Directions. Adults and children 12 years or older. 2 tablets every 4 to 6 hours. Not more than 12 tablets in a 24-hour period. Okay? Most drugs have a rate, if you will, of every 4 hours. Once you get less than every 4 hours, it's something that someone really needs. Whatever they have is really bad. Okay? Most drugs is every 4 hours. All right, here we go. 13.1 is done. Which government agency is responsible for making sure medications are safe to use, effective, and secure from tampering? Go. FDA. Very good. What are unpleasant symptoms that occur after taking a medication for a long time? What are the unpleasant symptoms? Withdrawal. Okay. What is the proper way to dispose of medications? Drop off at a drug take-back location or follow the instructions on the label or prescription to dispose of it at home. Okay? Really and truly, you should take all the medication. I know sometimes you can take 2 or 3 or take it a couple of days and all of a sudden you feel good. I do the same thing. All of a sudden I feel good, so I don't take it anymore. Okay? You should take it all. Okay? All right? All right, we are done with lesson 13.1. Arrange your notes, and I will we'll journey on to 13.2 in just a second.